Hey everyone's Coach D. I just finished a client session this morning with one of my newer clients, and she's a wonderful reminder of having an open mind, trying something new, but also being willing to discuss things and experiment with things. When you hire a health and wellness coach like myself, it is an experiment. It's detective work. It is a puzzle that we're going to figure out as a team together what works for you, because our human physiology is so complex that one thing may work for one client and not for another. And that's okay. That's the fun part of what I do. But it takes good communication. It takes effort from both sides to ensure that we can figure out what does work or does not work for the client. In this particular case, this client has a lot going on, and including fibromyalgia, and also lacks stress management tools, which I find seems to be quite common, unfortunately. And that can cause a whole host of things. And so you add on top of the idea that she doesn't have a lot of ways to manage her stress day to day. Add on top of that the pain and discomfort that comes from having fibromyalgia. That just accentuates the stress and the anxiety. So we've had, for the first month or so, our sessions have been primarily discussions. We've done a little bit of light movement. But in addition to the discussions, we've done breathing exercises. And we've started there. And even just with that, you can see the tension in her body that's built up over the years with not being able to relax and release that tension that our daily lives can bring. So we just added to her days box breathing just late last week. And for her, because she's also a smoker, we needed to do a lower count in box breathing. So it was one of those reminders that it's different for everybody. Quite often you'll see box breathing starting with a 4 or 6 count on each side of the box. Well, we're down to a 2 with her. That's okay, because this is still a challenge for her. So what box breathing is, for those who don't know, if we imagine a box in our mind, and if we start in this corner, we inhale for a count of 2, we hold the breath for a count of 2, exhale for a count of 2, and hold for a count of 2. That's one round. So this client in particular, we've challenged her to try this once a day out of her 5 breathing exercise times each day, which she's been doing very well. And so we challenged her with this just once a day because it's new, it's a little awkward, and she needs to do 5 rounds of it. So over the weekend, this was her first weekend to try it, and it didn't go so well. She tried it though. And that was one thing we discussed this morning, was that the act of trying is one of the big components of practice, right? You just have to put the effort out, and she sure did. But what she found was that it was tough to not only focus on the box, focus on her breathing technique, which we've been doing, and staying relaxed, but also counting the 2s while counting the rounds. It was just a lot for her. So here's an example of where we can either say, suck it up, try again, or we can try and modify. We say, okay, let's change this just a little bit to make it a little bit easier. What can we do that makes it a little bit easier? So the first instinctual thing that we discussed this morning that she's going to try before I see her again in a couple of days is using her fingers. So when she's doing this, she simply touches her thumb to her index finger for her first round around that box. Second round, she goes to her next finger, and she just moves down her fingers and returns for her last round with her index finger. So she starts and finishes here, which is the OK symbol, right? Excellent. And it was a really cool conversation, and it kind of was an aha moment for her to go, oh yeah, well that sounds good. I can do that. And that's exactly what we want, right? We challenge ourselves to the point where we push ourselves to do things we're not even ready for, or it's not even realistically possible for us where we're at in that moment. But for this client in particular, she was open to that conversation, open to trying it, continuing to try it. But then she said, hey, I can do that. I don't see why I can't do that. So then we can try and implement and experiment with it again. It's a really simple concept that we often avoid or skip over, or just think, no, it's too easy when it comes to our health practices. And if we just simplify and make things just a little bit easier on ourselves, maybe we would be healthier and happier for it.